This is a video on how to ambulate your patient successfully when they have tethers. A tether is any line connected to the patient that can hinder movement and increase the risk of falls or injuries. Some examples of tethers would include a Foley catheter, any compression device used to prevent blood clots, an IV, oxygen, and different things that would monitor vital signs. When you're planning to move your patient, you need to make sure that the pathway is clear. By ensuring that there's nothing that could trip the patient, you can prevent falls. Remember, anytime you have more than 2 tethers, you need to get an assistant. The goal, however, is to minimize tethers. When you're moving your patient, they should have a gait belt on and also non-skid slippers. That way, you can also decrease the risk of falls. It's important to have your patient sit up and at the side of the bed so that you can monitor if the bed is at an appropriate height to move them. You want to make sure that their feet can firmly touch the ground. So if you have a tall patient, you might have to raise the bed. If you have a short patient, the bed will be lowered. The bed should also be locked before you move your patient. Before moving your patient, you need to assess their tethers. So if they have a Foley catheter, you need to ask if they have enough slack or if anything is pulling. Remember that the Foley bag should remain below the level of the bladder at all times. Also communicate with the nurse to see if you can limit tethers. In this video, we have already disconnected the IV and saline locked it, and in real life you would need to get a nurse to do that skill for you. You can also remove any connection to vital signs and take off compression devices as well. It's important to communicate as a team, especially if you have a second person involved in ambulating the patient. Talk to that person about who will carry the oxygen tank or who will have the wheelchair. Think about if the wheelchair should be behind the patient in case they need to sit down while ambulating them. When ambulating, you want to position all the tethers in a spot that will not hinder the patient, and remember to keep the Foley bag below the waist of the patient. Also have a backup plan and frequently assess how the patient is doing. Do they have enough strength? Are they short of breath? Are they dizzy? And do we need to get a wheelchair so that they can sit down? Continue to communicate with the patient. Remember, it's a process and it's step by step. Our physical therapist and patient will now demonstrate how they will ambulate. Our physical therapist has positioned the Foley bag below the level of the patient's bladder, and she guides the patient to a standing position. The physical therapist also guides the oxygen tank as she walks behind the patient, ensuring that the patient does not trip or fall, and making sure none of the tethers are disruptive to the patient.